Hi everyone, welcome back to the channel. In today's video, we will go through coding guideline questions CPC 2025. If you found this helpful, please subscribe, like and share. So let's begin. First question. According to CPT guidelines, which scenario best represents the correct use of 78 modifier? A. Patient had an appendectomy 3 days ago in the hospital. The patient developed a fever and receiving an IV antibiotic for treatment. B. A patient returning to the ED in the same day for the same ED physician to perform an extensive anterior packing for hemostasis a second time. C. Patient had an open inguinal hernia repair 2 weeks ago. He is in the doctor's office because the surgical wound is bleeding. The physician cleans the wound and applies wound adhesive to reclose a small opening. D. The patient has an abscess under the diaphragm from an appendectomy. He is returned to the OR for the same physician who performed the appendectomy to drain the abscess. So, modifier 78 means unplanned return to the operating or procedure room by the same physician following the initial procedure for a related procedure during the post-operative period. Must be related to the original procedure, unplanned return, same physician during the post-operative period. These are the key points to remember. So, we can examine each option. In option A, no return to the OR or procedure room, only medical management. So it is wrong answer. In option B, it is in same day, but the procedure is ED. Modifier 78 is usually applies to OR or procedure room returns. So this is also a wrong answer. In option C, patient had hernia repair 2 weeks ago. Now in doctor's office for wound clearing and wound adhesive to reclose a small opening. Minor procedure in office, not a return to OR or procedure room for related procedure. So this is also not 70. In option D, patient has abscess under diaphragm from appendectomy, return to OR for same physician to drain abscess. Here, return to OR for related procedure, same physician during post-operative period. So this is the correct use of 78 modifier. Always remember in using modifier 78, it must be unplanned return to the OR or procedure room. It must be same physician and related to the original surgery. It happens during the post-operative period. Okay. Next question. The documentation states he was then sterilized, prepped and drained along the flank and abdomen in the usual sterile fashion. I first made a skin incision of the tip of the 12th medially along the Banger's lines of the skin. This was approximately 3.5 cm in length. On this incision was carried sharply. Electrocautery was used. The access through the external oblique, internal oblique and the transverse abdominis musculature and fascia. What surgical approach was used for this procedure? A. Cannot determine based on the documentation. B. Percutaneous. C. Open. D. Laparoscopic. So here the documentation shows a 3.5 cm skin incision. The surgeon manually cut through multiple muscle layers with electrocautery. The area was sterilely prepped and draped. So here laparoscopic uses small incision with a camera. So here laparoscopic is wrong answer. Percutaneous is just a needle or catheter. I don't know incision. So it is also wrong answer. Open surgery involves a cutting through tissues for direct access. So here correct answer is C, open. Here, the surgeon cuts through multiple muscle layers. No camera was used. It's more than just a needle. So this confirms it's an open up. Whenever you see multiple layers cut manually, it usually open surgery. So remember that. Next question. According to parenthetical instructions in the CPT codebook, what modifiers will be reported when a blepharoplasty is performed on the right and left lower eyelids? A. 59, B. RT, LT, C. E2, E4, D. 50. Here, a patient has blepharoplasty performed on both lower eyelids. Which modifier should we report according to CPC instructions? Modifier 59 is for distinct procedures. RT or LT is used for laterality, and ET or E4 are not standard CPT modifiers. So the correct choice here is modifier 50, because CPC instructions tell us to use 50 for bilateral procedures. So whenever a CPT code is performed on both sides and the parenthetical instructions say bilateral, use modifier 50. This will help you avoid common mistakes on the CPC exam. Okay, bilateral 50. So this is all for today. If you found this helpful, please subscribe.